Hello there, and welcome once again to The Verdict. Mick Cornett with Kent Meyers. We're here every week, meeting interesting people and dealing with topical issues. And we got Julie Bisbee coming in today.
Coming in with a new title.
Yes, that's right. It was interim last time.
It was interim last time. Interim has been scrapped, and she is now the official executive director of TSET.
They do so many good things, and I'm glad we're doing this show because it'll allow people to understand the resources that are available. I don't think there's a single person in this state who couldn't benefit from something that TSET's doing for them.
Yeah, they're doing a lot more than things that are just related to tobacco.
Yeah, we're coming a long way in health. We still got a long way to go, but we're coming around. Julie Bisbee, the executive director at TSET, is here today. She'll be our guest when we get back.
One of my first experiences working in TV as a production assistant, I was like, ask me to do anything and I'll do it. I'm just here to work hard. And so I think that eagerness goes a long way. My name is Ezekiel Walker. I am a TV producer in Los Angeles, and I am Chickasaw. As a kid, I saw the opportunity behind the lens to capture great stories. And I feel as though that's my purpose in life. And really close to my heart is the stories of my own people. There's a need to represent Native Americans and minorities in a genuine way. The Chickasaw Nation started with strong ancestors. It started with survivors. I have a responsibility to not let that be in vain, but to work hard and to keep moving forward and to keep conquering.
See more stories about the Chickasaw people at profilesofanation.com.
We want to reach out to every veteran we can in Oklahoma. There's somewhere around 340,000 veterans here in Oklahoma, and half of those are still unaware of the benefits or don't know how to go about getting them.
We help guide the veterans through the VA system. It's a giant maze, and we kind of help guide them through that maze. So our job is to try to help the veterans get everything that they're legally entitled to. There's just a special place in my heart for our Vietnam veterans and our World War II veterans, as well as any veteran, and that's why I do the job.
And welcome back to the set of The Verdict. Mick Cornett with Kent Meyers, and Kent's going to introduce today's guest.
We are really pleased to welcome back to the set of The Verdict for another visit Julie Bisbee. But she comes with a new hat, as we indicated. She is now the executive director of TSET. Last time she was on, she was the interim director. But after a search, the hiring folks made a wise choice and picked Julie as TSET's executive director. She is a graduate of Ball State University. She has had a varying career, including being a newspaper reporter for the Associated Press, which is what brought her to Oklahoma. In 2012, she joined TSET, and in 2019, she was named executive director, and this is her second appearance on The Verdict. Julie, welcome back. Glad to have you.
Thank you, and thank you for those kind words.
Let's start with sort of the history of TSET and how it's available to Oklahomans.
Sure. So the Tobacco Settlement Endowment Trust was created by voters in the year 2000, and this was in response to the Master Settlement Agreement, which was a settlement between 46 states and Big Tobacco. And basically, with that lawsuit settlement, Big Tobacco agreed to stop using commercials, cartoons, and other things to market their tobacco product to children. And as part of that, with states, they agreed to make a payment annually to the states that are part of that settlement as long as cigarettes are sold. And so Oklahoma receives an annual payment, usually in the spring, and the TSET endowment gets 75% of that annual payment. The legislature gets 25% of that. And of that 25%, the Attorney General takes a portion because there is still ongoing enforcement, making sure that the inventory of cigarettes in the state is what the sellers say it is. And so that ongoing enforcement is part of the Master Settlement Agreement as well. So Oklahoma is really a model for the nation because a lot of states took that money and saw it as a windfall and invested it in a variety of needs. What Oklahomans did, what voters did, was safeguard the majority of those payments to the state and use it for health. So we have an endowment, but we only use the earnings to fund grants and programs to prevent and reduce the risk factors for cancer, cardiovascular disease, and also prevent and reduce tobacco use in our state.
And it's perceived, I'm on the outside looking in, but Attorney General Drew Edmondson had a lot to do with that, with
He
the
did.
formation of that. Yeah.
He did. He was one of the original that brought the lawsuit, and then he was part of that core group of attorneys generals that negotiated the settlement terms.
And my perception, in my opinion, probably more than anyone else's, but I think it addressed the sense when you look at our state legislature on a historical sense, not wanting to point fingers at any specific legislature, they don't always have a long-term view. And I think it was kind of the will of the people that created TSET that, let's create an endowment so we always have this money to try and improve the health outcomes in the state of Oklahoma.
Definitely. And like you said, the legislature has a short-term budget cycle, and they are responsive to those pressures. But what the evidence, what the science shows is that prevention is a long-term investment. And we have programs that help people quit or help people change their behaviors, but we also work across communities in the state to say, how can we stop these harmful habits and behaviors before they start so that kids get off to a healthy start, that families can support what it is that is going to help us be healthy workers and taxpayers and, husbands, wives, all of the things.
Right. I see the commercials, the cessation commercials. What sort of results do you have to show that they've been effective? Sure.
The Oklahoma Tobacco Helpline is probably our most well-known program, and that's by design, because you want people who know a smoker or a tobacco user or now vape users to be aware that there are free services, free nicotine replacement therapy available to them to help them quit. And of those results, we know that we have exceeded national benchmarks in helping people quit. We know that the majority of people that are calling the helpline are calling because they saw a commercial, and the majority of them don't have insurance. And so we are really a lifeline for people who are wanting to make those choices and providing that support. That is one of the most impactful things that you can do to improve your health, is to quit smoking.
Some of the most effective commercials that I've seen have been your commercials. Are they done in-house, or do you outsource those commercial preparations?
So we do a variety of things. A lot of other states have media commercials that they do to promote their helpline, and in fact that is one of the evidence-based things. It's not enough to just have a helpline. You need to tell people you have it. You need to reach them when they might be at a time to be contemplating change. So we have, borrowed from other states. The national CDC has a warehouse of commercials where, any state can do and tag. But we have also done commercials in-house. And so the commercials that are running right now through the Tobacco Stops With Me program, it's called Not Okay. Those were all produced by Oklahoma companies with, our creative team.
They're very effective, I think.
Thank you.
Let me ask you, what, if you can generalize, what kind of fund comes in annually from TCent, for which you get 75%, the legislature gets 25%?
Yes, so about 70 million comes to our state. It varies, and it is based on the sales of cigarettes nationally, and I think that is a really important distinction, because what we know about how people are using tobacco now is that they're moving away from cigarettes. They're choosing vapor devices or others. But generally, it's between 70 and 65 million annually that comes to the state, and then we get the 75% of that deposited into the endowment, invested. We have a separate board of investors, or those are really experts in growing and maintaining that fund, and when we use those earnings.
The investment oversight, how are those people appointed?
So the investment, we have a board of investors through the constitutional language, and they are appointed by different elected officials. So the governor has an appointee, the state treasurer is the chair of that investment board, the House Speaker, and then the president of the Senate.
And has the endowment grown since it was established? Because I know y'all are spending, and rightfully so, a good deal of the money.
Yeah, so the endowment has grown. When I look back at the history of TSET, we were really excited to fund the helpline. That was the very first program, and we knew this is where we need to put resources. As earnings grew, we were able to layer in the communication component to promote the services. And as the earnings grew again, we were able to do community-based grants. We want to help communities move towards health, but we know that all the answers don't come from Oklahoma City or Tulsa. Local folks need to be invested in that change for it to be lasting and sustaining. And so you've seen our programs change over the years. Our earnings have been pretty steady over the last 5 years. We are finally kind of recovering from a 2016 downturn in the economy overall, but we've been pretty steady, and so we've had to be very targeted in how we are using those funds and to use them for the most impact.
Is the trust funded solely by cigarettes? Would vaping products, the sale of them, contribute to the foundation?
So the master settlement agreement was about the harm that cigarette smoking had done to states. And so the annual payment is based on the sales of cigarettes only, which is a very important distinction. Thank you for pointing that out.
Well, let me ask you another question. I noticed on your website, TSET says that it's interested in creating a state of health in Oklahoma. In other words, it does not limit its mission simply to tobacco. Can you talk about that a little bit?
Yeah. So we know that, tobacco use, physical inactivity, and poor nutrition are the leading causes of the 4 diseases that are killing Oklahomans at a higher rate. And that would be lung cancer, diabetes, COPD, and then, of course, cancer. And if we can reduce those risk factors, then we can not only reduce the cost to the state, but also help people live longer, healthier lives. And so that's where we are talking about creating a state of health. We also know that typically when you are physically inactive, you're not making great nutrition choices. And so if you can get people on a path for health, and I think, Mick remembers that during his time in office, if you can get them to make one healthy decision, that's a cascade effect. If we can get folks to reduce their tobacco use, they feel like moving. They're going to move more. When they are embracing health, they're going to make different and better choices for their diet. And so it's important that we support and address all of those things.
They're all interrelated, aren't they?
They are all interrelated, and they are all risk factors for cancer. Cancer and cardiovascular disease are killing our people at a higher rate than other states. And so it's important that those resources are in place to help our state flourish.
Are we doing better?
We are doing better. Since we started doing our work, we have seen smoking decline. We are now at about 19%. The national average is closer to 13%. We've got room to grow, room to improve. Obesity has been holding steady. That's good. No state has really seen a large decline in obesity. It's a national and international issue. And we've seen some strides in our youth obesity, kind of a leveling off there.
Julie Bisbee is the Executive Director of TCent. We'll be right back with more.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank #2 in the nation. OU Law, generations of excellence, limitless possibilities.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
Welcome back to the set of The Verdict. Mick, Cornett, Kent Meyers, and our guest, Julie Bisbee.
Julie, talk to our viewers about what programs you have designed to help children.
Sure. You know, really it is helping young people have healthy diets, healthy physical activity. So we do that through a couple of different programs. Of course, our community grants are working to pass policy and promote healthy practices for all ages. And we know in our rural communities that that is going to be most impactful for our youngest and our oldest. And so we work there. So we work within schools. We help schools look at their policies and see if there are improvements they can make for health. We have Shape Your Future, OK, and that has resources for all ages. How can you improve the nutritional value of your child's lunch? It is really geared towards the decision makers in the home to make it easier for them to provide healthy options. We also have physical activity videos, tips and tricks that you can do there because we know Oklahoma families are busy and sometimes it is easier to just run through the drive-through, but a sandwich costs less and goes further, turkey sandwich with a little lettuce and tomato. But those are the things that we do. And then most recently, our board has approved a $2.5 million annual investment for 5 years for a program and a campaign that would help to educate youth, sort of older children, on the harms of vapor use and ways to stop and also prevent that use. We've seen that vaping number climb dramatically over the last few years, and it's very troubling. It is very troubling, and so our board has approved those funds, and we hope to have commercials and other supportive materials running by fall.
Rural health care has always been an issue, and just getting the necessary resources and health care opportunities. Is TSET involved in that? We are. One of the things when we were looking, we got our bases covered with tobacco. We had those programs in place. But we knew in the rural areas that people were not able to access preventative screenings or have that conversation with their doctor about tobacco use or improving their health. So we've partnered with the Physician Manpower Training Commission, which is another state agency, to do loan repayment for doctors. And what they do is recruit doctors. We actually have a lot of people who are coming here from other states to take advantage of this. And if those doctors work in underserved areas, rural underserved areas, they can get up to $160,000 in loan repayment, which is a big deal when you're coming out of medical school and starting your practice or starting your family and you have $200,000 to $300,000 in medical loans. What we found is that doctors typically stay where they were placed for the loan incentive. They've built a practice, they're part of the community, and physicians have $1 million impact on the communities that they serve, and you think about how that can help stabilize a health system to have a physician that's committed to being there, and then all of the other professionals that work under the supervision of a physician as well. And so that's been a great program that we've been able to increase access, increase doctors talking to their patients about tobacco use, and also bring them into communities to be partners for health. Big subject at the state capitol now is Medicaid expansion. Does TSET have an opinion about all of that? Well, session is always a really fun time.
That's no fair.
But, what we see is that doctors really do play a part in helping people improve their health. We want to support that, but we also want to have communities that are going to be supportive, to have healthy options, have the opportunity for physical activity, safe places to be. And that's kind of where we like to put our resources is how can we help the average Oklahoman sustain those things that the doctor is telling you to do in their office, and you get outside and you think, I've got to pay bills, I've got to do this, this, and this. If we have communities that are supporting those healthy behaviors, people are more likely to do them.
Mm-hmm. Talk about your collaboration, if you will, with the Oklahoma Hospital Association. insofar as Healthline referrals?
So they are a partner that we have a grant with. They work within hospital systems. They're really an expert and a trusted source of information in different hospital systems. And it was, how can we get your doctors and all, nurses to be talking to patients about tobacco use? That is one of the most proven ways. We're here to talk about your health. This is serious. Folks are motivated to quit and motivated to get that cessation. And so the Hospital Association has been a good partner to work with individual health systems to say, what's going to work for you? And how can we get folks seamlessly referred to the helpline? Not another piece of paper that they've got to keep track of, but would you like more information about cessation? Yes, I would. Great. Someone will reach out to you. So we've worked really hard to create the data sharing, and if any of your viewers are in healthcare, they know that can be a significant challenge. But the helpline then can contact these patients, and it's a seamless referral supported by the doctor, but also with, of course, the patient saying, yeah, I want to try again. Most smokers have to quit 5 to 7 times, and so it's something that everyone is always kind of struggling with, and there's always support for it.
You mentioned earlier in one of your answers about the vaping problem. Can you describe its breadth here in Oklahoma?
Yeah, so vapor products is the most commonly used tobacco product by young people in our state. We know that from surveys that we do.
More than cigarettes.
Yes, yes. And it is very troubling when we look nationally at the data. So there was a time after the 90s where youth tobacco use was declining. We're seeing that curve back up again because youth vapor use is increasing. Like I said, we have grants across the state, and we hear anecdotal reports of, fifth grader brought a Juul pod to school, or kids in the middle school bathroom are vaping. Teachers are sort of at a loss as to how to contain this. I think the Tobacco 21 that the president signed into law is a really good step, because you are removing young people, and 90% of smokers start before they are 18, and they become daily smokers before they're 22. You're removing that older peer group from maybe a high school freshman who says, hey, you should try this, or how can I, supply you with this? And having the age to purchase tobacco at 21 hopefully will help reduce that. But there are other things as a state that other states have done that would help kind of get a handle on the issue, to include licensing vapor retailers. Tobacco retailers have to have a license. Currently, vapor retailers do not. And so that's just a place where policy probably needs to catch up with practice.
What about cancer research?
Cancer research is another place that we have invested in. It's part of our constitutional mandate. When the folks were, looking at the ballot and saying, where do we want this money to go? They knew, and rightly so, that tobacco-related cancers continue to be a top killer in our state. Lung cancer, completely preventable. And so we have partnered with the Stevenson Cancer Center, and our state now has a National Cancer Institute recognized treatment facility there. The TCet funds help support the Phase 1 clinical trials program, one of the top in the nation for enrolling patients and really giving them alternative therapies. Maybe you've tried all of the traditional therapies for your type of cancer. They are developing new therapies. They're bringing them to this state. They're helping Oklahomans get care in-state, close to home, close to their support network and family, and that is really a game changer for our state.
What should Oklahomans know about TSET that maybe they don't know already?
Or how can our viewers help you?
Well, that's great. That's a good question. I think that, a lot of folks maybe know us for the helpline. That is one of our flagship programs, but they may not know that we are supporting health in their communities as well. Health is not just something that happens at the doctor's office. It is something that communities support and provide opportunities for, and I think that that's something that I hope Oklahomans understand, that it's a spectrum. We don't want to just be helping people who maybe are already sick. We want to help prevent them.
Julie Bisbee is the Executive Director of TSET. Kent and I'll be right back with the final word.
Thanks so much for coming.
Thank you.
It used to be okay in hospitals, It used to be okay in movie theaters. It was okay in classrooms, restaurants, and airplanes. But thanks to a greater understanding of the dangers, that's not okay anymore. So now that we know secondhand smoke causes lifelong health problems, why is it still okay to smoke with children in the car? Bottom line, it's not okay. Let's get serious about protecting kids. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
You have children come from a different lifestyle, different mindset. You have to open your arms and really do what you have to do to have that child become a part of your family. And if it's more patience, that's what you do. Kids got to know they can trust you. And that's what we try to do with these kids.
You will always be mom and dad to me.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Welcome back to the set of The Verdict. Mick, Cornett, Kent Meyers, wrapping up a show with Julie Bisbee, the Executive Director of TCET.
Yeah, Julie is really a fine person to head TCET since she's been there that many years, and she's got some good programs going.
A lot of different things they do. Smoking, cessation,
well beyond,
cancer
well beyond
research.
tobacco.
Yes, it really is. Looking at health holistically, and we all know that Oklahomans struggle with health, so we're grateful to Julie and her staff and the Tobacco Settlement Endowment that is helping us address some of these needs.
I hate to think where we'd be if we didn't have TCET.
Absolutely. Well, we have some website information to pass along to you, and you'd think I'd have that out here in front of me as I introduce it. Here it is, tset.ok.gov. That's tset.ok.gov. And we have a website. We'd love for you to log on and tell us about a guest you'd like to see or a subject you'd like to see Kent and I address. That's going to do it for this week's show. For Kent Meyers, I'm Mick Cornett. We'll see you next time.